Okay, today's question is about Blue Cross Blue Shield. Does it cover TMS? What is the criteria for coverage for TMS by Blue Cross Blue Shield? I'm Dr. Bawarshi. I'm a psychiatrist at Florida TMS Clinic. We're in the Tampa Bay area. I answer questions about TMS. If you have any, you can submit it in the comments below, or you can send it via email or through our website. Okay, so Blue Cross Blue Shield is very strict on who would qualify for TMS. In our state, in our area, it's called Florida Blue, and they are actually the largest commercial provider in our area. So for Florida Blue, they require failure of 4 antidepressants in the past from at least 2 classes of medications, and then they require 2 augmentation treatments in the past to consider somebody to be treatment-resistant depression. So let's read the criteria in details. Number 1, the patient obviously has to be confirmed severe major depressive disorder, single or recurrent without psychosis. Okay, that's the diagnosis that we require. I told you already in previous videos. Single episode meaning that this is the first time that somebody had experienced depression. Recurrent episode meaning that the patient had recurrent episodes in the past and currently they're depressed and they had failed medications during this current episode. Okay, so it requires failure of 4 antidepressants. The medication should be from at least 2 different antidepressant classes. For example, a couple of them should be from SSRIs, a couple of them from SNRIs, or it could be 3 from SSRIs, 1 SNRI, could be tricyclic antidepressant, monoamine oxidase inhibitor, what have you. But they cannot be all from one class of medications because good practice usually you should change the class of medications when somebody does not respond. But also they require 2 augmentation treatments. So what is augmentation antidepressants? That's when you add 2 antidepressants at the same time, or you keep 1 antidepressant and you add a mood stabilizer that could enhance the effect of the antidepressant in the first place. There are other ways, to kind of do augmentation, but those are the main things that we usually do. Or intolerability of 4 antidepressants and meeting the above criteria, meaning that it has to be from 2 different classes of medication. They cannot be all from the same class of medications. And those should be documented distinct intolerable side effects. We spoke a little bit about GI side effects, whether they're considered to be distinct side effects or are those things that will improve over time if the patient continues treatments. For most of the real life clinical practice, some stomach discomfort in the beginning of administrating a medication should be tolerable, and it should get better over time. If it doesn't get better, that's a different story, but usually it will get better over time. Okay. The third way is failure of, a patient is candidate for ECT, and TMS is thought to be non-inferior to ECT for that particular patient, meaning the patient doesn't have comorbid psychosis or anything of the sort that would be better with shock therapy, and TMS is less invasive. So in this case, you can proceed with TMS instead of ECT. And the patient should have had psychotherapy in the past. Down the list in here, they explain that if a patient had tried TMS before and they need retreatment, then that's okay as well. So it's basically the same criteria as we had with Medicare and United, as I explained before. But back to the summary. It's 4 failures of antidepressants, 2 augmentation treatments, and psychotherapy. Okay? All right. Thank you. Disclaimer. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.